Hello everyone, today we're going to be doing an overview of the PICO model. So PICO is just one model that is used in evidence-based practice, which is just clinical practice based on research. So the model is used to focus clinical scenarios into questions that can then be researched. PICO is used to further condense the information into terms that would produce results when we begin a search. The ultimate goal of using PICO is to find the best evidence possible to provide the best care we can to the patient. So PICO stands for population, intervention, comparison, and outcome. The population is going to be the patient, their age, and any relevant medical history. The intervention is what we're going to be doing to the patient, and the comparison is any alternatives, treatments that we are considering for the patient. The outcome is the outcomes that we want for the patient that would come from our intervention. So an example where we could use the PICO model is about Sharon. So Sharon is a 43-year-old woman who recently had breast augmentation surgery. She is due for her yearly mammogram for breast cancer screening, and Sharon wants to get a breast ultrasound instead of a mammogram because she is anxious about the complications from the mammogram machine due to her implants. So we break down that scenario into the population, which is a 43-year-old woman who had breast augmentation surgery. The intervention in this scenario is a breast ultrasound. The comparison is the usual mammogram, and the outcome is breast cancer screening with no implant complications. So we take that breakdown from the scenario and then we form it into the clinical question. So this question is, in a woman who had breast augmentation surgery, is it better to prescribe a breast ultrasound instead of the usual mammogram to screen for breast cancer and to reduce the risk of complications due to the breast implants? So to search for research that will answer that clinical question, we'll just narrow down the search terms. So for the search, I would use breast augmentation to start, and I would also include ultrasound in that search. And for the outcomes, I would use the breast cancer screening because that's what we're focusing on. We want to screen for breast cancer for women with the breast implants. So is using the ultrasound okay, or do they have to have the usual mammogram? So the search, just the basic terms, so breast augmentation, ultrasound, breast cancer screening. And if that's too many results, we could further specify the results by including complications or mammogram. Okay, so that was just a short overview of PICO. Thank you.